Good afternoon and welcome. I am Dr. Ritu Saha, Associate Professor and Head, Department of Microbiology. Today I am going to discuss with you about Paramyxovirus, which is an important enveloped RNA virus. What is Paramyxovirus or properties of Paramyxovirus? They are spherical, pleomorphic, and diameter is about 150 to 300 nanometer and composed of RNA genome, protein, lipid and carbohydrate. The genome is single strand RNA, linear and non-segmented. It is negatively sensed and have 6 structural proteins. The slide is showing you differences and structure of Paramyxovirus and difference of it with the influenza virus or orthomyxovirus. The envelope of Paramyxovirus contain viral hemagglutinin and neuraminic acid in a single spike and have a fusion protein which mediates fusion of the virus with the host cell. The virus replicates in the cytoplasm and is antigenically stable. This slide is showing the difference of influenza and parainfluenza or paramyxoviruses. Here we are showing that the orthomyxovirus or influenza virus have segmented genome, whereas the paramyxovirus have linear single-stranded RNA genome. The paramyxovirus is antigenically stable, whereas the influenza or orthomyxovirus have antigenic variation due to their segmented RNA genome. In orthomyxovirus, the spike protein of hemagglutinin and neuraminidase is on different spike, whereas in paramyxovirus, the spike is in single spike protein. Classification of Paramyxoviridae. Paramyxoviridae is classified into 2 groups, Paramyxoviridae and Pneumoviridae. Measles, mumps, human parainfluenza, Hendra and Nipah viruses are subtype into Paramyxoviridae, whereas human respiratory syncytial virus and human metapneumovirus is classified into Pneumoviridae group. Now I am going to discuss about measles virus in details. In today's session, we are going to learn about the characteristics, incubation period, pathogenesis, epidemiological feature and clinical stages of measles virus. Characteristics of measles virus. Measles virus has a hemagglutinin but no neuraminidase. It induces formation of internuclear giant cell. Humans are the only natural host. Acute highly infectious disease characterized by maculopapular rash, fever and respiratory symptoms. Complications are common and may be serious. It has effective live virus vaccine that dramatically reduce the incidence. Epidemiology. Reservoir. Man is the only natural reservoir. Transmission is predominantly occur by respiratory droplet and also by contact infection during conjunctivitis. Incidence. Most incidences occur in between 1 to 5 years of age. 90% of individuals have had the experience of measles and it has worldwide distribution. Epidemic attacks occur in late winter and early spring. Now, pathogenesis of measles virus. Incubation period is 9 to 11 days. It is highly contagious, most frequently occurs in children. The virus transmitted from person to person by droplet infection. It invades the bloodstream, which means primary viremia, and localize in the reticuloendothelial system. Then secondary viremia occur when the flu-like symptom or fever, coryza, cold, etc. are occurring. In this slide, we are showing that the pathogenesis of measles virus in short. After the incubation period, measles virus migrate into the regional lymph node and then primary viremia occur. Then no sun symptom occurs, but the virus reside in the reticuloendothelial system. Then secondary viremia spread into the body surface, and prodromal illness, that means fever, cough, etc. are occurring, and it is associated with epithelial necrosis, giant cell formation and profuse viral shedding. The disease transmission mostly occur in the period of prodromal illness. Then with the onset of rash, antibody production begins and viral replication and symptoms begin to subside within 5 to 7 days. This slide also show about the pathogenesis of measles virus. After primary viremia, the virus go into the reticuloendothelial system, then secondary viremia occur and profuse viral shedding occur in the blood, and our immune system, T cell mediated and humoral immunity both give protection, and rash occur after 5 days of antibody production or cell mediated immunity appear, that indicates antigen antibody reaction. Fate of measles virus: after infection with measles virus, it may cause recovery that gives lifelong immunity, and no resolution phase occur where acute infection is continuing due to defective cell mediated immunity. Also, subacute sclerosing panencephalitis or post-infectious encephalitis may occur as a consequence of defective immunity. Clinical disease or clinical phases of measles virus. Number 1 is prodromal phase. Here, high fever and 3C symptom, that means coryza, cough and conjunctivitis occur, and this period lasts for only 2 to 4 days, and patient is highly infectious in this stage. Number B, Koplik spot. This spot occur after the prodromal period and 24 to 36 hours before appearance of the rash. The spot is characterized by red spot with bluish white centers on the buccal mucosa and situated just above the lower molar teeth. Here the serological event or natural history of measles virus infection. Before 14 days of onset of rash, the virus entry into our body. Then the prodromal phase begins 7 days before rash appear, and after 5 to 7 days of rash appear, the disease subsides. But as a long consequence, subacute sclerosing panencephalitis is developed. When rash appear, that indicates our cell mediated immunity and antibody mediated immunity both are acting against the virus, and antigen antibody reaction is the predominant cause of the occurring of rash. Exanthematic stage or rash occur in this stage. Here, widespread maculopapular rashes appear on the skin, mucous membrane and conjunctiva that last for 5 days. The rash results from interaction of T cell with virus infected cell in small blood vessels. The rash does not appear in individual with defective cell mediated immunity. Here is a picture showing you about the classical rashes produced in measles virus infection. Here I am showing you the Koplik spot situated on the just opposite to the second molar teeth in buccal mucosa. Thank you very much. In next class, I will discuss about the laboratory diagnosis and complications of measles virus infection.